Hello friends, welcome back to the channel of Clinical Care Insight. In our today's video, we are going to talk about the Mpox virus, also called as the Monkeypox virus. Nowadays, this virus is, you can say, highlighted in news. Okay, it's highlighted in the newspapers. Fine, and the reason behind is that there is an outbreak of Mpox viruses. Now, Mpox viruses is endemic in certain, you can say, continents, like it is endemic in the Africa or South Africa, okay, and their nearby countries. One of the challenging thing about this virus is that there is no any specific treatment guideline. Okay, there's no any specific treatment protocol for this virus. Now, this virus is similar to the smallpox virus. It is similar as the smallpox viruses, and their sign and symptoms is also similar. Fine, but there is one specific sign and symptom which make the distinction between the Mpox and the smallpox virus, and that distinguishing feature is the lymphadenopathy. This lymphadenopathy means swellenness of the lymph nodes. It is present in the case of Mpox, whereas in the case of smallpox there is no any lymph node swelling. Okay, there is no any swellenness of the lymph node. Now, the other symptoms, like you can say the lesion formations, the fever, malaise, fatigue, headache, it is similar in both like a smallpox and in the Mpox virus. Okay, now the another thing is that if we're talking about their shape and size, now this is a long, okay, this is a long as compared to the smallpox, and also the shape varies. Okay, the Mpox virus shape is a brick shape. Okay, Mpox virus shape is a brick shape. Now, if we paying the today's attention to the today's data, then data is showing that there is a emergency outbreak, okay, in the South Africa region, in the, you can say, the other countries like the Uganda. So in these countries, nowadays the cases are emerging, and WHO held one Zoom meeting, okay, on 14th August, and in that meeting they make, you can say, the emergency, they make emergency team. Okay, so WHO on the ground, they are working with the African population. They are providing the machines to analyze the viral sample. Okay, now coming to their origin, how this virus is come in our body. See, there is no any specific clear-cut description about the origin of Mpox virus, also called as the monkey virus. Some research shows that it is come from the Campion monkey. Some research shows that this is a variola, you can say the variant of smallpox. Okay, so there is no any clear-cut origin, but their transmission is this is basically a zoonosis, means it's spread from, it can spread from the animals to the humans. Okay, and also if we're talking about the transmission, then there's a human to human transmission. It can primarily transmit through the you can say respiratory droplet. Okay, other thing is the saliva. Fine, and apart from that, the skin to skin contact. Now, one research shows that this, you can say, the sexual contact, okay, it can spread this virus. Sexual contact spread this virus. Fine, and one of the research they are showing that this Mpox viral load is found high in the saliva. Okay, it is found high in the blood, it is found high in the urine, as well as in the sperm. Fine, so it shows that the sexual route transmission is one of the cause of this Mpox virus transmission. Another thing is that WHO with the IHR, International Health Resource, okay, they held the meeting, and in that they declare the emergency alert. Okay, they declare the emergency alert, and this is now restricted to only the endemic countries like the Africa, okay, and also in the Uganda and nearby state. If we're talking about the Asian population, then there is no any, till now there is no any Mpox report is found in the India, but one case is found in the Pakistan. A person who nearly recently traveled from the Saudi Arabia to the Pakistan Peshawar, and they are diagnosed with this Mpox virus. Okay, so if we're talking about their treatment protocol, then there is no any specific treatment protocol. Generally in the case of viral disease, there is no any clear you can say description of treatment. Okay, but generally treatment goes with inhibiting their DNA replication. Okay, and that is done through a drug, okay, called as the tincovitate and the bizidovitate. These are the two drugs which is used generally to inhibit the you can say their genomic synthesis. Fine. Now if we're talking about their you can say pathogenesis, then pathogenesis is simple. We acquired through skin to skin contact, a sexual contact, or airborne droplet infection. Fine. And it comes in our nasopharynx area, oropharynx area, or through the you can say the subcutaneous transmissions, and it's replicate inside our body. Okay, and it goes to the lymph node, and thereby it's swelling the lymph nodes. Okay, swelling the lymph node, that is called as the lymphadenopathy. And after 1 to 2 weeks there is a you can say formation of lesion inside the mouth as well as in the skin. Okay, so if we're talking about the prevention, one of the prevention is to isolate the patient. Okay, and for international concern, we have to provide the rapid testing. Okay, rapid testing for this virus, so that we stopped the transmission of this virus from one country to the another country. Okay, so always remember that prevention is better than cure, so we have to take this preventive measure. So if we recap today's episode, then we basically discussed about the Mpox virus. Okay, it's primarily transmitted through human to human sexual contact. Okay, and this is a less if we're talking about the morbidity and mortality rate, then this is a less than the smallpox. Until now there is no any case reported in India, so don't panic by hearing the news. Don't panic yourself. Okay, so thank you for having us. Bye.